If you've been diagnosed with high blood pressure, you might be worried about taking medication to bring your numbers down. High blood pressure is not usually something that you can feel or notice, and it can go undiagnosed because there are usually no symptoms. Regardless, high blood pressure can lead to kidney damage, stroke, or a heart attack. Therefore, it's important you get your blood pressure checked regularly. Check with a doctor or nurse how often you need to get it checked. Here are some lifestyle changes that you can make to tackle your blood pressure and keep it down. Lose extra weight and watch your waistline. Blood pressure often increases as weight increases. Being overweight can sometimes cause disrupted breathing while you sleep apnea, which further raises your blood pressure. Weight loss is one of the most effective lifestyle changes for controlling blood pressure. Losing even a small amount of weight if you're overweight or obese can help reduce your blood pressure. In general, you may reduce your blood pressure by about 1 millimeter of mercury with each kilogram, about 2.2 pounds of weight that you lose. Besides shedding pounds, you generally should also keep an eye on your waistline. Carrying too much weight around your waist can put you at greater risk of high blood pressure. In general, men are at risk if their waist measurement is greater than 40 inches, 102 centimeters. Women are at risk if their waist measurement is greater than 35 inches, or 89 centimeters. These numbers can vary among ethnic groups. Ask your doctor about a healthy waist measurement for you. Exercise regularly. If you have high blood pressure, exercise can help you to avoid developing hypertension. If you already have hypertension, regular physical activity can bring your blood pressure down to safer levels. Some examples of aerobic exercise that you may want to try to lower your blood pressure include walking, jogging, cycling, swimming, or dancing. You can also try high-intensity interval training, which involves alternating short bursts of intense activity with subsequent recovery periods of lighter activity. Strength training can help you to reduce blood pressure. Aim to include strength training exercises at least 2 days a week. Talk to your doctor about developing an exercise program that will suit you best. Eat a healthy diet. Eating a diet that is rich in whole grains, fruits, vegetables, and low-fat dairy products, and which is low on saturated fat and cholesterol, can lower your blood pressure. It isn't easy to change your eating habits, but with these tips you can adopt a healthy diet. Keep a food diary. Writing down what you eat, even for just a week, can shed surprising light on your true eating habits. Monitor what you eat, how much, when, and why. Consider boosting potassium. Potassium can lessen the effects of sodium on blood pressure. The best source of potassium is food such as fruits and vegetables rather than supplements. Talk to your doctor about the potassium level that's best for you. Be a smart shopper. Read food labels when you shop and stick to your healthy eating plan when you're eating out. Cut down on salt. Even a small reduction in the sodium in your diet can improve your heart health and reduce blood pressure by about 5 to 6 millimeters of mercury if you have high blood pressure. The effect of sodium intake on blood pressure varies among different groups of people. In general, limit sodium to 2,300 milligrams a day or less. However, a lower sodium intake, 1,500 milligrams a day or less, is ideal for most adults. To decrease sodium in your diet, consider these tips. Read the food labels. If possible, choose low sodium alternatives of the foods and beverages that you normally buy. Eat fewer processed foods. Only a small amount of sodium occurs naturally in foods. Most sodium is added during processing. Don't add salt. Just 1 level teaspoon of salt has 2,300 milligrams of sodium. Instead, use herbs or spices to add flavor to your food. And ease into it. If you don't feel you can drastically reduce the sodium in your diet suddenly, cut it back gradually. Your palate will adjust over time. Reduce the amount of alcohol you drink. If you drink alcohol, stick within the recommended limits. No more than 3 to 4 units a day for men and no more than 2 to 3 units for women. Drinking more than moderate amounts of alcohol can actually raise blood pressure by several points. It can also reduce the effectiveness of blood pressure medications. Quit smoking. Each cigarette you smoke increases your blood pressure for many minutes after you finish. Stopping smoking helps your blood pressure return to normal. Quitting smoking can lower your risk of heart disease and improve your overall health. People who quit smoking may live longer than people who never quit smoking. Reduce your stress. Take some time to think about what causes you to feel stressed, such as work, family, finances, or illness. Once you know what's causing your stress, consider how you can eliminate or reduce stress. If you can't eliminate all of your stresses, you can at least cope with them in a healthier way. Try to change your expectations. For example, plan your day and focus on your priorities. Avoid trying to do too much and learn to say no. Understand that there are some things you can't change or control, but you can focus on how you react to them. Focus on issues that you can control and make plans to solve them. If you are having an issue at work, try talking to resolve it. If you are having a conflict with your kids or spouse, take steps to resolve it. Avoid stress triggers. Try to avoid triggers when you can. For example, avoid people who cause you stress if possible. Make time to relax and to do activities you enjoy. Take time each day to sit quietly and breathe deeply. Make time for enjoyable activities or hobbies in your schedule, such as taking a walk, cooking, or volunteering. People may need to take more than one type of medicine to control their blood pressure. Don't stop taking your medication without consulting your doctor first. Monitor your blood pressure at home and see your doctor regularly. Home monitoring can help you keep an eye on your blood pressure, make certain your lifestyle changes are working, and alert you and your doctor to potential health complications. Blood pressure monitors are available widely and are available without a prescription. Talk to your doctor about home monitoring before you get started. Regular visits with your doctor are also a vital part to controlling your blood pressure. If your blood pressure is well controlled, check with your doctor about how often you need to check it. Your doctor may suggest checking it daily or less often. If you're making any changes in your medications or other treatments, your doctor may recommend that you check your blood pressure starting 2 weeks after treatment changes and a week before your next appointment. Supportive family and friends can help improve your health. They may encourage you to take care of yourself. If you find that you need support beyond your family and friends, consider joining a support group. This may put you in touch with people who can give you emotional or a morale boost and who can offer practical tips to cope with your condition.